Virginia is announcing in a week that it's set to reopen. We keep hearing from Governor Northam that hospitalization rates have somewhat plateaued across the Commonwealth. So I'm curious to know what both of you have seen, if your lives have, I don't know, become a little more, I don't want to say stress-free, but if things have calmed down somewhat. But I'm just eager for you to describe what you've been experiencing over the past week, and if things have somewhat began to calm down. Whoever wants to begin, go for it.
I think things, I wouldn't say necessarily have slowed down. I would say that it kind of comes in waves, ebbs and flows. I would expect that the worst is pretty much almost behind us, but I wouldn't say slowing down would be an accurate measure of where we are currently.
Erik, what do you feel? Do you feel the same way?
I would agree with that. I think we have adapted very quickly, and our team, including the nurses and respiratory therapists and ECMO specialists, and the leadership has been incredibly supportive. And we've adapted to a quote unquote new normal, a COVID normal, if that's a bit of an oxymoron. So the hospitalization rates may have plateaued, but there's still a lot of people. Our hospital is still full of patients with COVID infection, and a lot of them are still on the ventilator. Some of them are still on ECMO support, and we anticipate that even though the rate of new cases may be plateauing or even declining, there's all these really sick people still in the hospital that are going to need care before we're able to sort of see a decline in our business. We're also anticipating, like Sana said, that maybe the worst peak is behind us, but as the state reopens and as we start doing elective cases again, which is very important, we need to do that because there's a lot of people that are waiting to have necessary and even urgent procedures, and it is safe to come to the hospital. The patients with COVID are in negative pressure rooms, so I've been in the hospital now for 6 weeks with COVID, and we're fine. We wear our masks, and patients are in negative pressure rooms, so it's safe to come to the hospital and have your elective procedures done. We do anticipate that as the state opens up and more elective procedures are done, that we may see another surge in new cases and new admissions of COVID.
Mm-hmm. So Sana and Erik, you both are very busy. Would you say that a word to describe your operating environment right now for Inova, for the hospital, isn't overwhelmed, but maybe just a sustained level of, you put the best way to describe your operating environment right now, if you could just one more time elaborate on that point, if you want to. So now, why don't you go first?
The operating environment in the hospital?
Yeah, or whoever wants to go first. Because we're trying to tell viewers, we have data that the hospitalization rates are plateauing, and yet we hear stories anecdotally that medical professionals are still very busy. So I don't want to, I feel as though overwhelmed is not the best word to use. How would either of you kind of describe the environment in which you're operating right now?
I would say we're still in a pandemic national crisis environment, and we have different procedures in place. Most of our ICUs are still, most of the rooms, the majority of, actually all of the rooms in our ICUs are negative pressure rooms. The majority of them are still filled with COVID positive patients. Each time you walk into a unit, you see people donning and doffing their protective gear. They're putting on their masks, they're putting on their gloves, they're putting on their gown, they're putting on their PAPRs, and they're going in and out of rooms. And then they're taking time afterwards to properly remove their protective gear. And that's a big change, because you see all the protective gear outside of the rooms. And then going into the room is not as simple as just walking into the room. You have to put on all your gear and make sure it's on properly, make sure your mask is fitting properly. And that's still, we've become we've adapted to that, a new normal, but it's a different new normal. And the COVID patients are mixed in with some of the non-COVID patients on some of the wards.
So to make sure, as I write stories over the next week, you would say that crisis mode would still be a good way of describing how you're operating. Crisis mode, but in this adjusted, adapted new normal. Do you both think that I kind of have that right?
I would, as being a bedside nurse, I would definitely consider my situation to be high alert.
High alert.
We are very conscious about our PPE, about the current environment, that we are taking care of these patients, as well as every time we're going into the room, we are well aware of the risks that we're putting ourselves in by taking care of these patients. So though the numbers may be plateauing, we are constantly high alert to protect ourselves and do the best for our patients that we can. And I'm sorry.
No.
As Dr. Osborn said, it is the new normal. Being in the ICU, we tend to operate under high alert, high pressure situations as is. But I think this is another level of being cautious and aware.
So I want to ask you both, what experiences so far since the middle of March you've taken away that are kind of these indelible experiences that when you two are ready to write your memoirs years and years from now, you'll always remember as an experience that's indicative of the time through which we're living right now. So for either of you, whoever wants to start, what's some experience that's happened at Inova that really sticks with you and is going to stick with you for years to come?
A couple of things for me. I currently took care of the youngest patients I've ever had in my nursing career, which would be the 16-year-old. To top it off on that, her father was a couple of doors down, and her mom was also in one of the ICU step downs. So when you think about the chances of you having pretty much an entire family being part of Inova's care and directly under your care as well, it's kind of amazing to think that, this virus is not picky. It, as young as 16, their parents as sick as being on ECMO and being on the ventilator and multiple different drips to make sure that we're doing everything we can to help this patient. It's just kind of amazing to see that we have an entire family that we're taking care of. Not many people can say that you have father-daughter team right a couple of doors down from each other. So that was a pretty interesting yet eye-opening experience, that this virus really doesn't discriminate. Young, old, healthy, unhealthy. It doesn't.
So tell me, I'm being careful not to talk over you with a half-second delay. But Jesus, tell me more about that family. Are they still in your care? Have any of those family members left the hospital? Tell me a little bit more.
I do believe the mom has left the hospital, and I believe the teenager is still in our care. I'm not sure what the status is as far as her father is concerned. I think Dr. Osborn might be able to comment on that more.
Sure, doctor, go ahead.
Yeah, the mom has made it out of the hospital and made a good recovery. The 16-year-old it's interesting, the younger, even though she was young and healthy otherwise, she's taking longer to recover than some of the other people. And we think maybe her immune system is more robust. So the quote unquote cytokine storm, the certain people get infected with this virus and we've never seen it before. So the immune system kind of goes crazy. And in a young, healthy person with a vigorous immune system, her immune system even went crazier, say, than her mom's. She is still slowly improving, but she's taking a long time. She's on her third week of ECMO and is inching forward. We're optimistic that she's going to be able to make it. She has age in her favor, but it's a challenge and interesting for just that it's a family situation.
Can I ask you both, did that surprise you about the 16-year-old, that she has no, prior conditions that would lend themselves to kind of the news media narrative that we've all become accustomed to, that, okay, well, she could be in for a very long, extended stretch of care. So did that surprise you, or were you kind of prepared for all the gamut of possibilities? And how has she been reacting? Is she kind of optimistic, or a very strong and charismatic patient, and responding to your care? Tell me more about those points, if either of you could.
She's still on a lot of medicine to keep her asleep most of the time, but she has a daily wake up. And it is interesting because she wakes up and looks at you with these bright young eyes, and she's able to follow commands, and she can move all four of her extremities. It's pretty uncomfortable to be on a breathing machine. She has a tube into her trachea that's helping her breathe, and she has 3 different cannulas that are connected to the ECMO machine, take the blood outside of her body, put it through a pump, drives it through a membrane lung, which performs the same function as her lung, and then we give it back to the right side of her heart. So that's pretty uncomfortable. She's got a lot of tubes sticking out of her. So she has, in most of the time, she's sedated with medicine, so she's asleep. I will say in the room next to her, there's another 16-year-old male who was otherwise healthy, was a football player, and he's also quite sick. And he came in just a few days ago, and we've got 2 16-year-olds right next to each other.
And does that surprise you? If I can just interrupt, does that surprise you, or are you beyond the realm of surprise at this point?
It did surprise us because you initially hear, oh, it's all getting older people, and then, oh, it's getting people that have diabetes and hypertension. Oh, it's getting people that are bigger, that have a very high body mass index, because having a high body mass index is a pro-inflammatory state. So your immune system is already revved up, then you get infected and immune system goes crazy. I will say we had a young soldier actually from the Colombian army. He's been on the Telemundo news, so I can say his name, Rodrigo, who was a very healthy 30-year-old in great shape, and he got very sick, and we thought, oh, well, he's going to be a quick run, he'll get better fast. He took longer than we expected to get better, and so we had a little bit of a warning that maybe the younger, healthier people might take longer to get better. He's made an outstanding recovery, even though we were concerned initially because he took some time to get better. He got convalescent plasma, and then our 16-year-old female young woman, I guess, got convalescent plasma, and then the 16-year-old male is in the remdesivir trial, so he's getting a antiviral medication.
What do you think of remdesivir? Do you have any thoughts that you'd like to share? It's on the headlines all the time. Just curious about, and I'm glad that it's a trial that's going on at Inova. What do you think about it?
The evidence is mixed. There was one study that said that it improved outcomes or maybe shortened the duration of the illness from 15 to 11 days.
Right.
There was a trend towards improving survival, but on the statistical analysis, it didn't meet statistical significance. So it's actually, my opinion, I think it's too early to know if this is really going to have a significant mortality benefit in terms of saving lives. I think that people were excited about a drug that had some positive information that it might help. And I think it's going to help. It's going to slow down the replication of the virus, so it's going to help. I don't think it's going to necessarily be a cure. I think the cure is going to be high-level critical care and taking care of these patients with the best evidence we have in the ICU, and then time, and letting their own immune systems recover while we support their body as they're adjusting to the virus.
I'm sorry for being ignorant on this point, but does every hospital get remdesivir? Is it unique or special that Inova is part of the trials here?
I think it depends on where it was approved for emergency use, and it was approved for being in particular in studies. So we're involved in a academic study, a research trial that's looking at remdesivir. I would have to say I don't know the answer about the other hospitals. heard different reports on the news that some of them have it, some of them don't. I did hear a doctor from Johns Hopkins last night saying that some of the academic centers are not getting it as quickly as some of the other centers, but
Right.
a lot of us are academic centers. We don't have it. We're connected to VCU, so we have research trials ongoing at Inova.
So now let me jump back to you. Any other impressions that you have that you'll take away with you besides the 16-year-old and her family? What else do you see in your role that we don't get to see, out here? Tell me about some of them if you could.
I think what a lot of people, we are fortunate enough to have PPE here at Inova, and they have been doing a stellar job at making sure that we are protected. I think a lot of what people are missing is just how much of a emotional and physical toll it takes on us as healthcare providers to be in that room with the patients and having to constantly be aware of your surroundings. Hopefully you don't trip over anything. Hopefully you don't accidentally stick yourself with anything. Hopefully nothing splashes you. And it's just that constant kind of internal dialogue that you have of making sure that you are protecting yourself as well as doing right by your patients. A lot of the general public doesn't realize the long hours that we spend in these rooms, how uncomfortable the PPE is, how much we are reliant on our colleagues and other individuals to help us, and the difficulties we have even just communicating in these rooms because of negative pressure and all the gear that we have on. I think a lot of people underestimate how much help is needed in order to take care of these patients, and caregiver fatigue, if anything, is probably at an all-time high right now as well. I think that speaks to people that are constantly 10 to 12 hours at a bedside with one of these patients. And given how sick they are, you may not get a chance to have a bathroom break or get a lunch break because you're too busy making sure that you're taking care of this patient who's extremely sick.
So you just segued into my next question. So now, what is a typical day like for you? 10 to 12 hours? Do you have a day off? How many patients do you see? Kind of a ballpark. And then Dr. Osborn, I'll switch over to you. But take me through what your day is like.
My typical day, we work 3 12-hour shifts a week. My day starts with coming in and changing into hospital-issued scrubs. We protect our own clothing. We do a handoff with the charge nurse as an oncoming shift. After that, we pretty much gather all our gear. As Dr. Osborn mentioned, there is helmets and masks and gowns and gloves pretty much everywhere. They've taken over the unit. You grab your PPE, you get handoff from the nurse that has taken care of the patient for the last 12 hours. I work night shifts, so my day starts at 7 p.m. And then you go in, assess your patient, you decide on a plan of care, you participate in rounds with the oncoming night team as well. Dr. Osborn, or whoever the attending is that evening, will be rounding with their other providers, mid-level providers, as well as the bedside nurse, so that we're all on the same page as far as plan of care for the patient. After that, towards the end of the shift, you basically do it all over again, just with the oncoming shift.
Wow. Could you give me some more adjectives before I switch over to you, Dr. Osborn, how you feel at this point, whether it be confident, tired, just some adjectives that speak to how you feel now, where we are in this point in the pandemic.
Well, that's hard.
I'm sorry.
It's an emotional roller coaster, to say the least. One day you're feeling great because you took really good care of the patient, you made a difference. The next day you come in and they're not doing so well. You kind of sometimes wonder why you're doing this, and you have good days and bad days, just like anything else. I think overall we are, I don't know how to describe it. It depends on the day, and it depends on the patient. We're anywhere from a realm of frustration to being grateful to being angry, to it depends.
Can you tell me about about that, if you could. I don't want to pry too much, but what are the angry moments? Angry that just this disease seems to be so indiscriminate. Tell me about that, if you could. I don't think that a lot of us hear that on the outside.
It's I guess it's anger and fear kind of mixed together because it's so unknown to us. We don't really know what this disease is doing as far as the patients are concerned and what the implications means for us as healthcare providers that are going to be in the rooms with these individuals for extended periods of time. I think it's just, it's fear of the unknown, fear of making sure that we have the appropriate equipment to be protected and to be able to do our jobs. Also kind of fear and anger that we are on the front lines, and it's just like, as Dr. Osborn will tell you, being in battle. No one asked for this, but it is something that is needs to be done, and it needs to be done by people that want to and need to be there for those individuals that in this time of unknown need people like us.
Yeah.
So it's a mixed bag of emotions. It depends on the day and it depends on the moment.
Right. I can't even comprehend, whenever I feel, terrible about like getting razor thin close to a deadline, or, just like some element of a story I wish I could report better, or something that this crisis has exacerbated. I always have to remind myself it's nothing compared to what, you two are going through. Doctor, give me some adjectives in the same vein of how you feel about your daily routine, if you could.
Sure. I guess first I need to echo, I feel inspired and grateful by the work the nurses have done. And I've been in combat. I was in the military for 23 years and been in multiple combat zones and medical emergencies. And this is what it feels like. And, we risk our lives to go and fight for our country in Iraq, Afghanistan, and Africa. The nurses are risking their lives by going in and spending an entire day with a patient that has a potentially fatal infection. Now, thankfully, the leadership at Inova has done a great job of ensuring we have adequate protective gear, but we're fortunate because we had warnings. Not everyone had that. Our nurses we have not had anyone get infected, at least in the ICU, or the ECMO team have not been infected, so their protective gear has worked. But the point is, you go into combat, you risk your life, you get hazard pay or combat pay. So that song, I don't know if you can hear the music, that means somebody was discharged.
Oh, no kidding, right now.
Yeah, that's a fight song. Yeah, they play it every time someone with COVID is sent home.
Oh, wow, over the loudspeaker.
Morale booster, yeah.
How about that?
Yeah.
That's great. Yeah. Wow, that's really terrific. What does that feel like? What are you two feeling right now?
We feel grateful. It's a small victory. To go back to when you're in combat, you get hazard pay or combat pay because of the risk you're taking. The nurses that are spending all day in a COVID patient's room, really should get combat pay or hazard pay. And a lot of them have. It's hard right now because I realize the healthcare system across the country is struggling financially because of all the decrease in elective surgeries, et cetera, and elective procedures, and the cost associated with taking care of COVID. But I have to say that we're inspired by the bravery of our nurses that spend all day in the COVID rooms. How I feel, like Sana said, it's really a roller coaster. Thankfully, our ECMO patients and our ICU patients have done pretty well. We've had almost an 80% survival rate, which is excellent. However, that means when you lose someone, so last week we had 2 people that didn't make it, young people that expired, and I had to talk to the families, and that was very, very difficult, to the point where you feel profound sadness. There's a great sense of, it's a sacred time, and it's an honor to be able to be there with the family. But how do you tell a 16-year-old that their 45-year-old father, who was healthy 3 weeks ago, passed away from this virus you can't even see? And 80% of people get a mild version and don't really get that sick. A very small percentage get super sick and end up not making it. that's very hard. And that, like Sana was saying, it does wear you down emotionally. We try to focus on the ones who survive and be inspired by those who survive. We're focused on some of the periods where, you know, in a time of crisis, the essence of what it is to be human comes out, and some of the intrinsic goodness comes out. I had a patient who was 82 and was very sick, had taken our last ICU bed, and probably wasn't going to make it. So we were in discussions with the family that, you know, this is their father, but he's 82 and he's got devastating pneumonia, is likely not to survive. We found out there was a 44-year-old at another hospital who was in emergent need of ECMO. He was dying on the ventilator and he needed a higher level of support. We initially had to say, we don't have any beds. And then I don't know how it came to be, but we ended up talking to that family and we told them, listen, you know, are you willing to let your father move to a lower level of care so that he can provide, or that we can offer this room to someone who's young and has a much higher chance of surviving. And the nobility that that family showed was really was profound, and it reminded me of the Medal of Honor that combat recipients get when they save the lives of their fellow servicemen and women. And they, you know, the family said, this is what Dad would have wanted. He would have wanted to be able to do something altruistic at the end. And he knew that he'd lived a good life. He was ready to go, and he was able to give this gift of life to a 44-year-old who was much younger. And that profound altruism, sort of American altruism or just human honor, was inspiring. And you try to remember cases like that or principles or events like that because they inspire you.
What did you do after that, doctor? After that conversation happened, what do you have to take a moment to process all that happened? And similarly, after speaking with families in other circumstances who have lost their loved ones, what do you do after you've had those conversations to reset and keep doing your job?
I take a couple deep breaths. I learned in sports, you know, the visualization and brief meditation. So I take a few deep breaths and then I talk to my colleagues. We're not in this alone, and you like to make sure that you're not making these life and death decisions alone. You're in a multidisciplinary team. So you're talking to your colleagues, you're talking to the nurses, you're talking to the other members of your ECMO or ICU team, and you're sharing your feelings, and you talk about how hard it is. You recognize that this is really difficult. You remember the lives we've saved. You make sure that you try to work out, get adequate sleep, get adequate rest. It's sort of like a deployment in the military. You get into the basics of sleeping and eating and working.
Yeah. So now, what do you do after a really tough shift? If you have a patient who you know is dying, what do you do? And is that the hardest part, dealing with death?
Absolutely. I think, as Dr. Osborn said, you definitely, after a hard night, or you know that this patient that you're taking care of is dying, there is this, especially now, there is this sense of camaraderie between not just the nurses, but different members of the care team for the patient, including doctors, respiratory therapists, even the techs, and all different kinds of nurses. We all kind of have to come together and recognize that we're all going through this together. And whether we've had a good night or a hard night, we treat each other as confidants, and we can talk to each other and discuss our feelings, because at some level, we're all pretty much going through the same thing. I also personally, I believe in the power of sleep. So if I've had a particularly hard night, there's nothing like some rest and relaxation in order to reset yourself. And that also helps put things in perspective for you. And as Dr. Osborn had mentioned, you do draw a lot of your inspiration from the individuals and the hard work that you do put in are able to save lives. But you kind of channel that energy when you do have a difficult evening or you have a patient that you know is, despite all your best efforts, is not going to make it. So that's how I deal with something that's a difficult situation.
I have two more questions. You both have been great, and I'm so thankful for all the time that you've carved out of your schedules. I just want to ping back to the story of the last ICU bed being taken up and that family agreeing to move their loved one to lower care. So was that, this is just for my own comprehension, was that early April? Are you in a time now where you have ICU beds that are free? We may have discussed this early on in our conversation, but doctor, just kind of paint the picture of when that time was and how your ICU bed situation is doing right now. Are there, like a half dozen, a dozen or more of those beds that are free? Tell me about that if you could.
Sure, I should have. That was early April when we were just ramping up and we were still increasing our capacity, and we were able to increase capacity. We had to quickly convert a lot of ICU beds into negative pressure rooms. That took some time. And then as we were filling up with COVID positive patients, we also had to move the patients who were not COVID to other ICUs. So that was several weeks ago. And right now we do have ICU beds. However, the beds that are available for ECMO are also limited because there's a certain, only a finite number of machines and a finite number of the specialized team members that can take care of ECMO patients. So there's a restriction on the number of ECMO beds that each hospital is allowed to provide because there's just, we have 100 ventilators and we have far fewer ECMO machines.
So do you happen to have, I'm really putting you on the spot. If you don't have the answer, that's fine. Do you happen to have a ballpark figure of how many COVID patients are being treated by you guys right now?
Sure. I can tell you the ICU patients in terms of the patients who've been sickest and who've required mechanical ventilation, meaning their COVID pneumonia was so severe they needed a breathing machine to survive. We've treated about 100 of those patients here.
Since the middle of March?
Correct.
Okay. And what number are you at right now? Do you know?
How many admitted in the hospital?
Yeah. So like 100. Oh, so 100 is the total figure. So do you have, for instance, early April, we had 90 patients, and now we're down to 70 who are still in critical care. Do you have kind of a
Sure. The total number is about 100. Some of those have gotten better. Some of those have gone to heaven. There's a collection of people that are still on the ventilator, and it's just a rough estimate. And in this Fairfax hospital, probably about 20 that are still on some form of higher level respiratory support for their lungs.
Okay. What's like and this is just the final question on that point. So 20 people more or less still on ventilators. What's kind of like the high water mark of how many people were on ventilators? I know 100 total since March, but what was that high level mark in early April?
I would have to say, we could in theory go up a lot higher than that, maybe 30 or 40 at any given time. And then it also depends, do you talk about Inova Fairfax, and then do you talk, the hospital, we're a health system. So we have 5 hospitals, and Inova Fairfax Hospital has to be the biggest hospital.
Right. That 100 figure since March, was that just for Inova Fairfax or for the Inova consortium or collective?
For Fairfax, yeah, for the big hospital.
Right.
Altogether, it's probably been more like 200 vented patients. But.
Okay. We are almost done. You both have been so excellent. I just want to ask either of you to respond in any way you see fit. And we talked about this in the beginning, but I know you said that you both are ready for an increase in cases as Virginia begins to open up, but when I look at these headlines, we're pretty open, objectively covering the headlines, but still saying that there's a lot of apprehension that we feel and the public feels about things getting back to quote unquote normal or opening up. How do both of you feel, and how are you heading into next week and the next month? Whoever wants to start first.
I think, like you said, we are getting ready to prepare ourselves, not just, I would say, here, but mentally for a second surge, for what have you may, with Virginia opening back up.
Does that make you nervous? I mean, just bluntly?
It does. It does make me a little nervous. I think we, like Dr. Osborn said, we have been fortunate here at Inova because we've had enough of a heads up, and they've done such a good job at, excuse me, providing us PPE. But I think just as speaking from a personal standpoint, opening things back up, and we just have to make sure that people are still aware that, the virus still exists, and the threat for what have you may of getting sick is still very real. And I think as the weather is warming up and people are allowed to go out, I think the whole social distancing, wearing masks, washing your hands, maintaining all those precautions is going to be even more important.
Do either of you want to venture, and you don't have to answer this if you wouldn't like to do so, but do either of you want to venture an opinion? Do you think it's too early to start talking about this, about reopening some businesses? Is that the diplomatic smile of, no, I'd rather not say it, but remain out of the realm of politics? That's fine if that's the case.
So we need to maintain social distancing.
Yes.
And we need to be very careful, and we should expect, if we open up now, that there's going to be a second wave, and there'll be an increase in infections, and we can decide if that's something we want to handle. I think we're ready for it here at Inova. We've gone through the initial surge, and we were learned some good lessons. We have some scars, but we also have learned from the care the patients that we've had, and the patients who've not made it have become some of our best teachers. One of the things I say is that every physician has their own private graveyard. We walk through it alone at night, and our patients end up rising up and becoming some of our best teachers and our best professors. So you ask, what do you do when you lose somebody? You think about, what did we learn from this loss that we can use to save another life? And that's a way of honoring the patient who didn't make it. And it's also a way of finding a positive angle to it and being grateful, saying, okay, yes, this patient died, but we can be grateful because we learned this lesson that we can apply to the next patient. And that may sound like crazed optimism, but you need to be optimistic, and you have to have hope, because thankfully, most of the time we are able to save the people who are sickest with COVID. And we're fortunate to be able to do that.
My editor just buzzed me with one question, so on my phone here. So this is the final question. You have my word. We touched on it slightly, but she wants me to ask point blank to both of you, what is something that you have seen inside Inova's walls that we haven't seen, and you would like all of us to know about? What is something that you've seen that we don't get to see in the public eye that you think is worthy of recognition, that you think is worthy of our attention here?
I think that we are going through a pandemic, and the world is kind of on edge, but what people don't see is how something so negative has brought so much positive as far as the morale of healthcare workers, just being supportive and inspiring each other to do better, and reminding each other why we're all doing this, the sense of coming together, even though it is something that is so negative that we're experiencing. It has brought the community, not even just healthcare workers, but also the general public, that we're all on the same page of making sure that we're doing everything that we can to keep others healthy and outside of and keep them outside of the hospital, and making sure families are together and, you know, maintaining social distance, washing your hands, and doing all the things that we need to do to make sure that we're all happy and healthy. I think something as negative as this, even inside or outside the Inova walls, has brought a lot of the different segments of the community together.
Doctor, something you've seen that you think we should see on the outside?
I think the collaboration across discipline and the teamwork, the unity in the face of a common enemy. I mean, a quick story comes to mind. We had a 35-year-old who was on ECMO and was suffering from a COVID infection, who had a cardiac arrest from a large blood clot in his lungs. And there was someone in the room. And what was impressive to me is that within 30 seconds, 5 or 6 people that were outside the room put on their protective gear, went into that room, and then we did what we had to do. We gave him a clot-busting drug, TPA, that dissolved his blood clot in his lungs and got his heart came back, which was amazing. It doesn't always happen. And the teamwork that was required, the choreograph of each person knowing their role, being able to quickly put on their protective gear, people helping each other out, getting into the room, helping do CPR, push medicines, and then giving the right medicine was amazing. And that's why we train, and it's what we're here for. And we saved that guy's life, and he's still alive today. And for that, I'm grateful that, and it only happens with a team. There's only 2 of us here, but it's really each patient that walks out of this hospital, there are hundreds of people that come together that have to support him or her to save that life. Whether it's the housekeeping, the respiratory therapists, the people who clean the buildings, the leadership, doctors, nurses, x-ray techs. You think there's just doctors and nurses in a hospital. We are, they talk about us a lot, but really behind us and with us, there's an entire team of healthcare people and workers that's necessary to run a life-saving enterprise.
I think that's a great note to end on. How many years have both of you been practicing for? So when I eventually write a piece on this, I can say Dr. Osborn has been practicing for X number of years. Sana has been practicing for X number of years. Both of you, please let me know, and that's the last thing I'll write down here on this notepad.
I'd be just shy of 7 years. So for all intents and purposes, we can go with 6, and 7 is
almost 7. Okay. All right, doctor.
I've been practicing for about, I'm old, 25 years.
25 years. And combat was, you mentioned Iraq, Afghanistan, and Africa. Do I have that right? Fill in the blanks if you could about that.
Correct. Yes, I was deployed 6 times, and the deployments included such places as Iraq, Afghanistan, and Africa.
Marines, Army?
23 years in the Army. I was a physician in the Army. The Army paid for medical school, and then I worked in the Army and after medical school and I trained in the Army and then worked in the Army for 23 years.
Okay. All right.
So I recently retired from the military about a year ago and came to work at Inova full-time.
Wow, amazing. I feel like a weenie in comparison compared to both of you, just sitting here in my safe apartment telling your stories. Thank you both. This was really, really incredible. When I end up writing about both of you, whenever that may be, depending on the vicissitudes of breaking news, I will send a link to Tracy in PR, and she will give it to both of you. But oh my gosh, just my heartfelt thanks and gratitude to what both of you are doing. I know it just must seem cliche at this point to hear everybody telling you that, but just you both have risen to the occasion. It was so great to hear your stories. So I'll hit stop here, let you both go, and thanks so much. I hope that both of you get a weekend soon, that you both are almost ready to clock out and have some sleep time.
Well, you are doing your part by staying home, so we thank you for that.
I
have the easy job. It's not hard. It's not hard.
Mike, I appreciate. Thank you for taking the time out to cover, to do a story and take the time to get into the details. And we appreciate your support. And the media has been very supportive of the healthcare systems, and that helps us actually to know that we've got the country behind us and the media behind us supporting us. It means a lot. We get a lot of free meals, which is awesome. People, and we get, there, because you don't have time to eat. So if there's pizza or a sandwich from Potbelly or from Chipotle, you can eat it really quickly and keep going. So it's
Well,
not.
I hope you get Jose Andres soon, that he gets to drop by. I saw that you had a parade outside the other day, so I hope that at least you have, I don't know, some high ticket items like that, or some high ticket, not only meals but events to keep you all going. Let me hit stop right here. Just